In stage 2 of our fibromyalgia protocol, we're going to address the underlying causes of heavy and achy pain, stomach problems, and malabsorption of nutrients in a normal, healthy diet. If you haven't already seen stages 0 and 1, you can still start here, but you may want to go back and watch those if you have pain that wanders from place to place around your body.
I got pain everywhere.
Or if you'd like a foundational understanding of our approach to fibromyalgia treatment. The focus of stage 2 is on relieving heavy and achy pain, and this is largely associated with gastrointestinal problems.
We don't want you getting an upset stomach.
Specifically a gastrointestinal microbiome with overgrowth of pathological yeast species like Candida. Candida by itself isn't a problem. It's a fungal yeast that's a universal member of the human microbiome. Everyone has it.
Everyone? Everyone!
The problem comes when it grows out of control relative to other species, especially the flora we associate with good health and long life, such as lactobacillus. Candida is opportunistic. It builds biofilms throughout our GI tract, which should be protective against damage from acid, from foreign particles you might accidentally swallow, like a splinter on your food, and that provides a breeding ground for normal bacterial flora to live in. Unfortunately, when those normal bacteria are killed, say as a result of an immune response to an infectious illness or by using a prescription antibiotic, Candida can and often does grow out of control to fill in the gaps. This can prevent your normal flora from growing back as easily, and that same mucus can become a breeding ground for bacteria you don't necessarily want hanging around very much. These bad bugs can be associated with the development of various states of illness or disease, including fibromyalgia pain, especially the heavy and achy pain we are going to address here in stage 2. If you've been through stage 1 and eliminated the wandering pain we so often associate with reactivating viruses like Epstein-Barr, you've already laid the groundwork for success here.
Congratulations!
One factor behind EBV reactivation is the presence of excess biofilm and the critters it can host. So by using Wind Tea, MicroGuard Plus, and the Tibetan Foot Soak, and by doing self-massage of the cervical lymph nodes while humming to activate your immune system and break loose that biofilm in your nasal sinuses, you're getting a jump start on what we'll be doing here with stage 2. The focus for stage 2 is on the GI microbiome because it has to be. Research has shown a clear link between disordered digestive function and chronic pain, as shown here where IBS patients were 40 to 80% more likely to experience migraine, fibromyalgia, and depression. Additionally, the heavy achy pain we're addressing in stage 2 is very similar in presentation to the pain described by patients with osteoarthritis, which research has also shown is more likely to be developed by patients with a disordered microbiome. Since our focus for this stage is on the GI system and the microbiome, we should talk about appropriate nutrition.
Correct nutrition is vital, man.
If you've looked around on the internet about nutrition and fibromyalgia, you'll probably have seen people recommending everything from keto diets to vegan diets to water fasts to gluten-free to putting food in places you wouldn't normally put it, like a coffee enema.
Why?
And while drastic restrictive diets that focus on eating a very specific way can and do help some people, they aren't sustainable for most folks for the long term.
It's diet!
Additionally, the health and wellness culture around these diets often promotes behavior that can isolate people socially or push them to develop eating disorders, which we'd really like to avoid. If you've tried cutting things out from your diet and it significantly reduced your pain and suffering, I congratulate you and wholeheartedly support you continuing to eat that way if you want to.
Good for you. Good for you.
For many people, it just isn't possible. So our focus here is going to be making very small, sustainable changes that move folks in the right direction and using traditional medical strategies to help our bodies adapt to the environment and the foods around us. After working with thousands of fibromyalgia patients for over a decade, what I find works best is to outline basic nutritional principles of a moderate diet. I want you to eat with your family and friends, to enjoy everything delicious that life has to offer, and I want you to honor your medical history and limits when it comes to certain areas. To start, I want you to remember the things your grandmother tried to tell you. Eat slowly, chew your food, be grateful for what you're given, and try to give back when you can. Food is love, and it should be shared. That being said, there is some truth that the modern American diet isn't necessarily the best for our health, as shown by our rising rates of diabetes, cardiovascular disease, and cancers that are all associated with excess sugars, fats, calories, and alcohol. Yes, those conditions, like fibromyalgia, all have multiple causes that we can't always control for, like genetics or air quality. But what we can control is what we eat. So we're going to do that within reason. Again, we're seeking balance here. Usually nothing drastic is needed.
Balance.
The traditional diagnostic workup of heavy and achy pain is attributed to environmental dampness. Again, speaking toward the similarity between fibromyalgia and osteoarthritis, many patients describe their pain as being worse in cold and damp weather or in wintertime, and better when the weather is warm and they're able to sweat and move freely. In traditional cultures, this is addressed through diet by avoiding excess of any one thing. Dampness is an excess condition. Techniques like gentle intermittent fasting, if you tolerate it, are a simple way to go into caloric restriction and help your body eliminate some of that excess. When you are eating, don't eat too much meat or oily, greasy food. Don't eat too much sugar or grains, and just generally don't eat too much. Small, easily digested meals are your friend.
Fish are friends, not food.
It's totally fine to eat frequently if you want, especially if you have a hypoglycemic tendency and you don't want to go all hangry. Just keep the portions small.
Uh-oh, someone is hangry.
If you always feel bloated or tired after eating, eat just a little less. If the bloat and fatigue don't go away from doing that, we will cover what to do about it in just a moment. The basic template we're going to follow here is protein, vegetables, whole grains, and herbs and spices. Most of the things you'll find in the spice cabinet are plants that are good for your microbiome's diversity. Some of them, like turmeric and chili peppers, are associated with cardiovascular health or decreasing your risk of cancer, and especially the fragrant aromatics like rosemary, thyme, sage, and oregano are rich in volatile oils that are powerfully antifungal. Season your food. You don't need to burn a hole in your tongue with spiciness, but try to gently warm up your belly. In that vein, a cup of ginger tea before breakfast and lunch, or cooking your food with ginger, is also a generally good idea. Ginger has a wide variety of health benefits, and hundreds of thousands of scientific studies have been done on it. For our purposes today, it warms the stomach to assist digestion, and it moves blood and gases like nitric oxide around to reduce inflammation and pain. If it causes you to feel worse or creates any stomach pain that bothers you, just leave it alone. And we usually don't advise drinking it at night because for some people it can affect their quality of sleep. Another good thing to include in your diet, if you don't already, is fermented vegetables. Not a lot, but small servings of sauerkraut or kimchi with meals are a great way to increase your intake of vegetable fibers and the lactobacillus that love them. Probiotics are widely touted as a cure-all for digestive conditions, but the evidence just isn't there. Ferments, however, have a long tradition of use for GI health, and especially the warmer ones like kimchi for reducing the negative effects of environmental cold and dampness on the human body. Yay for old stinky food! Now, after you eat comes the fun part, because we're all going to embrace our inner puppy and get a tummy rub. It's easy to overthink any kind of self-massage, and I am going to give you detailed instructions for best practices here in a sec, but more importantly than doing it perfectly is to just do it. Go for a 5-minute leisurely stroll around your yard, your neighborhood, your office, or your living room every time you eat while rubbing your hands around your tummy, and you'll notice better digestion pretty quickly. Abdominal massage has even been scientifically studied with a randomized controlled trial and shown to help relieve constipation. If your bowels are too loose, this can make it a little worse at first, but almost always helps people find the happy middle after a few days of consistently doing it, especially if you're also using the botanicals, which I will talk about next. Best practice for abdominal self-massage are: stand up, relax your knees, pooch out your tummy, cross one hand over the other, and pull your stomach in towards your spine. Now maintain that pressure in both directions while you move your hands around in a great big circle from your ribs all the way to your pubis. Bob your knees a little bit to move your hips up and down, and twist your waist side to side to get an extra strength effect. Go for a little while with your hands in one direction, maybe 30 or 40 times, more if you like, it is okay. Then switch directions with your hands and go the other way about the same amount. It doesn't matter if you start clockwise or counterclockwise, just do both. Some people will say that one direction is better for constipation and one for diarrhea. I don't think it matters, and you've got a lot of plumbing in your abdominal cavity overlapping itself, so just go both ways. Now that you have the hand movements down, if you don't want to bob your knees like that, you can go for a short, gentle walk while you're doing this. If you notice this practice makes you burp or fart, you get bonus points. Let's talk about botanical medicine. Our stage 2 protocol is a stack of 3 products to reduce heavy achy pain, promote better digestion through several mechanisms, and reduce candida yeast while donating healthy prebiotic fiber that your healthy flora love and need. The first is Warm Hearth Tea. This formula is based on a timeless classic known as Erchen Tang, which loosely translates as the 2-aged ingredient tea because its 2 main ingredients are best when they are aged for a while. Pinellia ternata is the king herb here and starts off our battle against candida. Pinellia is a tuber that's harvested on the summer solstice each year in China, which is what gives it its name Bansha, meaning half summer. The timing on this harvest is important, as Pinellia is the chief herb we use to dissolve phlegmy biofilm. Phlegm is considered the most yin of pathogens. It is the end stage of water metabolism pathology, where clean, healthy water has stagnated, become thick with mucus and yucky pond scum growth, and is no longer good for your health. High quality Pinellia is harvested at the peak yang moment of the year to counteract this yin pathology. Its innate biofilm busting ability is focused and maximized by this traditional farming practice. It's then fermented with ginger to detoxify it, warm it up, and enhance its powers even more. Citrus peel is the second aged ingredient. You may be familiar with those cute little easy to peel tangerines we get in the US around Christmas time. What you may not know is that the peels from these holiday treats are used in many places around the globe to promote healthy digestion, especially of the sweet and greasy foods we like to eat in wintertime. While this formula comes from traditional Chinese medicine, citrus peels are also commonly used in Europe as an ingredient in digestive bitters for the limonene content, a terpene that is protective of the stomach lining and can even help protect against damage from non-steroidal anti-inflammatory drugs like ibuprofen. Sounds like a good start, but these two aged miracles aren't enough. So Warm Hearth also includes 2 species of atractylodes, Lancea and Macrocephala. These are powerful fighters against Candida, as evidenced by this study where some poor mice were given a deadly fungal infection and Atractylodes Lancea kept them alive. Meanwhile, its cousin Atractylodes Macrocephala exhibits powerful anti-inflammatory effects on the nasal and GI mucosa, and inhibits mast cell-mediated allergic reactions. If mast cell activation syndrome is in your history, this may provide you with some steps toward relief. If it came on after COVID or another virus, please see our other video on MCAS, which goes a little deeper into that phenomenon and suggests you use some other products before coming back here. The last herb we'll talk about in Warm Hearth tea is patchouli. I know what you're thinking, what kind of hippie BS is this, but hear me out, because before it was appropriated to mask the body odor of annoying white dude with dreads and a djembe, patchouli was used in cooking to improve food safety. It's a delicious culinary herb that packs a punch against many of our worst bacterial enemies, including E. coli, Pseudomonas, Shigella, typhoid, and Staphylococcus aureus. The other 2 products recommended in this stage are Ermiawan and Microguard Plus. Warm Hearth and Microguard Plus have several of the same ingredients, and we're doubling them up here to have a stronger effect. Microguard Plus also includes several herbs that help many aspects of digestion, such as Aucklandia for bile flow and to repair damage from oxidized fats, Crataegus for protein breakdown, naturally occurring amylase so you can love eating bread again, and Acorus to calm your mind, so that you don't have to worry if what you're eating is 100% perfect every single time. Aquata is double awesome potency of Atractylodes Lancea and 30-year-old philodendron bark, a potent source of broad-spectrum berberine. If you'd like to learn more about that formula and its application here, see the Candida and berberine videos where I break it all down for you. So like I said in stages 0 and 1, you can get these products anywhere you like, but if you found this video helpful, we'd appreciate your support via the links below. Stay well, my friends, and stay tuned for stage 3.